I am Dr. Anil Kumar, Pediatric Cardiac Surgeon at KIMS Hospital, Secunderabad. Here we have here a family, a mother and a child from Nigeria with us. They came from Nigeria for cardiac surgery here. The kid is by name John. The kid is about 2.5 years old. He has been diagnosed to have a congenital heart disease and a problem called tetralogy of Fallot. It's one of the common problems in the heart in babies with congenital heart disease, what we call a hole in the heart associated with a valve problem in the pulmonary artery. So this condition called tetralogy of Fallot is something like is called a blue baby syndrome. So the baby was quite blue when he was born. When he came to us, he's 2.5 years, and he was very blue and saturating very less. His oxygen saturations were less than 70%. He was having failure to thrive and was not gaining weight. So he was diagnosed to have the problem at Nigeria, and he was referred here for surgery. The surgery he was operated last week, and the surgery went on well, and they are ready to go home back to Nigeria in a couple of days. I would like to briefly tell about this operation. This is called tetralogy of Fallot complete repair. When we mean complete repair, in the present day, we are able to repair the tetralogy of Fallot right away without staging, as earlier we used to do in a staged procedure. We used to do a BT shunt and then do a tetralogy repair later. But nowadays, even in infancy, even as early as 3 to 4 months of age, we are able to do complete repair of tetralogy Fallot without putting a BT shunt, a staged procedure. So in complete repair, what is done, the hole in the heart, that is the VSD, is closed, and the artery which takes blood to the lungs is completely repaired. In other words, the condition of tetralogy Fallot has got two main elements. There is a big hole called VSD in the heart associated with reduced blood flow to the lungs. The tube which takes blood from the right heart to the lungs is small, and the valve is small, and the entire outflow to the lungs from the heart is narrow. That is why the less blood goes to the lungs, and the baby becomes blue, and that is what we call a blue baby syndrome. So in repair of tetralogy, what we do essentially, we close the hole, we close VSD patch. VSD is closed between the two ventricles. The hole is completely closed using the patient's own patch, the pericardium that is treated and made thick, so without using synthetic material. And then after doing the VSD closure, we repair the pulmonary artery. We make it big. So in our technique of tetralogy Fallot in our institution, here in KIMS, we follow an aggressive strategy of preserving the baby's annulus. Annulus means the main base of the tube which takes origin from the heart. It's a fibrous structure, and it has to be preserved. If we cut across, if it is small, if it is borderline size, suppose we cut it, then we have to prepare a new valve. Otherwise the baby will have valve leak. So luckily this baby had a annulus size, that the base of the pulmonary artery is not very small, but it is acceptable in size. And with our technique of resection of the obstruction lesion, the resection of the infundibular obstruction, and with our technique of valve sparing, the pulmonary valve was repaired, and the baby had what is called a valve sparing repair of tetralogy Fallot. So it was a good repair, and the long-term outcome would be very good, because the baby would not require any more surgery in future, because the valve will not leak and the baby will have normal life. This is essentially called a valve sparing repair of tetralogy Fallot with preservation of the pulmonary annulus. Now, after this good outcome, the mother is here with us to share a few thoughts about her experience at KIMS hospitals.
My name is Oluwadamilola Akimbo. I am the mother of John Akimbo from Lagos, Nigeria. We are referred to KIMS Hospital from Lagos. My baby is John. He was born with a hole in the heart, simply put, tetralogy of Fallot. with a bluish color in the mouth, in his hand, in his leg. Immediately we got here, tests were run, then the surgery was done. Within 24 hours of the surgery, my baby changed. No more blue color. He can breathe very well. Before, if he's breathing, you'll be hearing his breathing. He cannot breathe alone. He cannot walk or do a very strenuous thing. Now he can play well. He can do so many exercises. We are fit to go now in a couple of days. I want to say thank you to the surgeons and the doctors at King's Hospitals. They have done a great job, and I pray God be with them. As we are going back to Nigeria, I'm encouraging parents with children with theater of the fallow to come to King's Hospital for a successful surgery. King's Hospital is the best. You can come there for your surgery. Thank you.